In this video, we are going to demonstrate basic surgical instruments used in obstetrics and gynecology. Obstetricians and gynecologists are using different types of surgical instruments depending on the availability, experience, and surgical need. However, undergraduate students need to know about basic surgical instruments, their function, and the uses. To easy understanding, we would like to classify the surgical instruments into cutting instruments, grasping instruments, retractors, and miscellaneous. First, we will look into the cutting instruments. Basically, cutting instruments are scalpel and scissors. If you see the scalpel, which has a handle and blade, and actually this blade we can fix and remove. The second is scissors. In gynecology and obstetric surgery, we are using a different types of scissors in shapes and sizes. This is a straight scissors which has handle, shaft and the blade, and the tip is blunt. This is another type of scissors which has handle, straight shaft, and the blades are curved and the tip is sharp. This is called fine scissors. It is called episiotomy scissors. It has a straight shaft which is also specially designed and curved because it is helpful to cut the perineum and avoid the anal sphincters to damage. This is another type of scissors using obstetrics called cord scissors, which is usually used to cut the cords after the baby deliveries, which is specially designed not to traumatize the baby or cord part. We will move to grasping instruments. These grasping instruments are used to grasp tissues during the surgery. First is Alice forceps, which has a handle with lock and a straight shaft and the jaw, and the tip it has a fine tooth which is helped to grasp the tissues with minimal damage. Usually this instrument is used to hold bladder during the bladder dissection. The second one is backup forceps, which is also had a handle with lock, straight shaft, and the jaw had a curved and fine tip, which is helped to hold the tissues without damaging the tissue structures. In gynecology, we are using to hold ovary or fallopian tube with this backup. This is a tissue holding forceps commonly used in gynecology and obstetric surgery. There are different names called little wood and Monihoni, and usually called as tissue. It also has a handle with a lock and straight shaft, and the jaw is curved, and the tip is tooth, which is helped to grasp the tissues with a grip. We are usually using to grasp rectus sheath with this tissue holding forceps. This is another commonly used instrument in gynecology called cervical bulging. It has a handle with lock and straight shaft, and the jaw is curved with the tip is a sharp tip to hold the cervical tissue. It is usually using to hold the cervical tissue during the dilatation curettage and hysterosalpingogram. This is called sponge holding forceps. It also has a handle with lock, straight shaft, and this jaw has a fenestration and wider to hold the gauze swabs, and it is used to remove the retained products in the cervix and the uterus during the evacuation of retained product of consent. And this is called green armatage, which is commonly used in obstetrics. It has a handle with lock, straight sharp, and the jaw is specially designed with a wider and without a fine tooth, without any damage, which is helped to hold the cervix and to do the cervical repair. It is also used in cesarean section to hold the cut edges of uterus. This is called green armitage. Let's move on another type of grasping instruments, which is also commonly used in gynecology and obstetric surgeries. This is called tissue dissecting forceps, which is actually help to hold the tissues during the surgery, and we are usually called as catch. It has two types of tissue dissecting forceps. One, it has a blunt tip, and other one is a tooth tip. So it is usually, the tooth tip is usually used to hold the tissues tightly like rectus sheath, and it is hold the tissues gently such as peritoneum or blood. Another set of instruments called hemostatic clamps, which has different types of shapes and sizes depend on the need. It is a straight clamps which has handle with lock, straight shaft, and the jaw is inside is specially designed to have a transverse ridge, which is helped to hold the tissues and the blood vessel together tightly to achieve the hemostasis. Another type of clamp, again straight handle with a lock, straight shaft, but the jaw is curved. And again, this inside the jaw, that is specially designed some longitudinal ridge with a tooth tip, sharp tooth tip, which is also helped to tightly hold the tissues with the blood vessels. This is commonly used to clamp the uterine arteries during the hysterectomy. This is a small hemostatic clamp we are calling as mosquitoes, which is also have to hold the tissues and the blood vessels, which is used in a superficial plane. Next, we will move to another type of surgical instruments called retractors. The retractors are basically used to retract the tissues and to get a good visualization of surgical field. We will see a couple of retractors which is commonly used in obstetrics and gynecology. The first one is very commonly used in obstetrics called Doyne's retractors. These Doyne retractors have a handle and the blade, which is specifically designed to accommodate the pelvis and to retract and push the bladder away from the surgical incision we are putting during the cesarean section. This is commonly used in cesarean section to push the bladder away from our lower segment incision. This is called Doyne's retractor. The second commonly used retractor in gynecological surgery is called Kelly retractors, which have a long blades and broad and long blades. It has a different shapes and sizes also. It also have a handle with a grip, and the blade is acutely turned, acutely bent, and it has a broad and long handle, which is helped to retract the tissues in the pelvic deep cavity. And another one is a Devers retractor, which is also helped in gynecological surgeries to visualize the tissues in the deep pelvis. This is a Morris retractor, which has two blades, the different types of blades, and the handle is in the middle, which is also used in the gynecological surgeries, but it is used in a superficial plane to retract the tissues. This is a small retractor called Cerny's retractor, which is also used in most of the gynecological surgeries to superficially retract the tissues and in vaginal hysterectomy also. These are called manual retractors. That is, a surgeon or the assistants needs to hold. There is another set of retractors called self-retaining retractors. That is, after the dissection of the plate, we can fix the self-retaining retractors and it can change the size and shape and fix it. Then it will permanently hold the surgical field until cell surgery finish. Finally, we will see some miscellaneous surgical instruments which is commonly used in obstetrics and gynecology. First one is a cervical dilators. This is called Hager's cervical dilators. There are different sizes. It's starting from 1 to 10. This is actually a number 10 size cervical dilator, which is commonly used to dilate the cervix before the traditional method of endometrial sampling called DNC, that is dilatation and curettage. So basically, these cervical dilators are used to dilate the cervix. This is called uterine sound. It has a handle and a long shaft, and it is bent at the end. So it is usually using to put through the cervical os to the cervical canal and the uterine cavity to see the uterine cavity length. We can measure. There are measurements also there, and we can orient the uterus whether it's anteverted or retroverted. This is called uterine sound. This is a curettage forceps which has a handle in the middle and there's a curettage part in the both end. One is a blunt end, other one is a sharp end, which is usually used to curettage during the dilatation and curettage as well as the evacuation of retained product of concept, ERPC. This is a punch biopsy forceps which has a handle and there is a jaw with a tip to take a biopsy from the tissues such as cervix and vulva. This is called punch biopsy forceps. This is a needle holder commonly using in surgery which has a handle with lock, straight shaft and the jaw. Jaw is specially designed with some ribs to hold the needle, which is used to hold the needle during the suturing. This is a towel clip which is to have a tooth tip to hold the towels after draping the surgical field. This is a metal suction catheter which is used to suck the secretions and the blood in the surgical field, and this is the end has some fenestration to suck the secretions. This is called Myanmar screw. It has a handle and the shaft, and there is a screw with the tip is sharp, which is used to hold the fibroids during the myomectomy surgery, and it can use to hold the uterus during the hysterectomy also. This is Leach-Wilkinson cannula. It's a cannula which is used to inject the dye through the cervix into the uterine cavity to assess the tubal patency in the hysterosalpingogram. So it has a long shaft and the cannula end, which is we are fixing the contrast medium here, and this pyramidal shape is specially designed to fix into the cervical os. This is called Wilkinson cannula. Finally, this is a metal catheter, metal urinary catheter, or we can call as in and out catheter, which is actually using to empty the bladder before the vaginal surgery. Thank you.